Obesity and pregnancy don't mix. They're very unhealthy for both mom and baby. And joining us this morning on this Medical Monday to talk about the importance of maintaining a healthy weight during pregnancy is Gundersen Lutheran OBGYN Deborah Simon. Good morning, Dr. Simon. Thanks for getting up with us.
Hi, good morning, Amy. Thanks for having me.
Thank you. Let's start by defining obesity. Is there a certain body mass index or a certain point on the scale where you define a woman as obese?
Well, we generally speak in terms of body mass index, which keeps in mind not only the patient's height, but also their weight and determining what would be a normal weight. And a normal weight would be considered between about 20 and 25 on a body mass index. Above that, there are different classifications, which would include overweight, obese, and morbidly obese.
Okay. If you are overweight, obese, morbidly obese, how does it affect your pregnancy?
Well, it affects pregnancy in a number of ways. Certainly when someone comes into a pregnancy with obesity, they have health-related risks that anyone with obesity might have. Those associations could be diabetes, hypertension, heart disease. And then how it affects pregnancy is similar, but the risks can be greater. For example, women with obesity are more at risk for having, like I said, diabetes coming into the pregnancy, or certainly developing something that we call gestational diabetes. They're also at higher risk for gestational hypertension, or hypertension that occurs during the pregnancy. And then around the time of delivery, there are also other considerations. Women who are obese are at higher risk for cesarean section, and the numbers can be as high as about 50% on women whose body mass index is 40 or greater, and a 50% risk of cesarean section is pretty significant.
Yeah. Okay, it sounds like obviously it's not very good for mom. What about baby?
Certainly babies that are born to women who have obesity have the risk of being larger themselves, and those risks can affect delivery, so might increase their risk of a cesarean delivery, which can affect fetal health some. If there are diabetes concerns, then those babies are at risk for being born with blood sugar issues that take time as they're transitioning to being outside of the uterus, and that can definitely impact the baby, at least especially in the early first days of life.
So obviously if you're planning a pregnancy and working at it, and if you have weight issues, you should work to do that before you get pregnant. But what about if it's, you know, kind of a surprise and you know you have a weight issue and now you're pregnant? Now what do you do?
Well, sure. 50% probably of pregnancies, number around there, are unplanned. And so a lot of women come into pregnancy with all kinds of medical conditions that they hadn't thought about previously, how that might impact the pregnancy. We recommend for different women different amounts of weight gain. Most women who are normal body size, we recommend about 25 pounds of weight gain. Women who are obese or morbidly obese, we recommend actually less weight gain for those women. And women who are below the normal body mass index, so less than a 20 on the BMI, we recommend that they gain a little bit more weight. But certainly staying active during pregnancy, eating appropriate things, and minimizing the weight gain in an obese woman will certainly impact the pregnancy and her risks of things like gestational hypertension, gestational diabetes, and whether or not she's going to have an infant that's larger than expected.
Mm-hmm. So obviously there are some risk factors, but can obese women still have healthy, happy kids?
Oh, absolutely. And as you know, and I think everybody in our country knows, there's a lot of talk about obesity right now being one of the problems that's becoming more common. And we certainly don't want anyone to think that this is something that they should feel stigmatized by, or feel like they should be embarrassed or ashamed about. I think that it's just something that women need to recognize is a major health issue. And when they do come to see their doctors, this is actually something that's hard to talk about for doctors. I know personally it's hard for me to bring up weight issues to women because I know that they have feelings about being overweight, and I think that if you can have an open communication about weight issues, obesity issues, any sort of pregnancy issue that someone comes to their doctor with, communication is really the key to overcoming some of the obstacles and having a happy, healthy pregnancy.
All right, well, Dr. Simon, thank you for joining us this morning and talking about this issue. I know it is pretty common in the U.S., so we thank you for your insight.
Yeah, thanks a lot, Amy.
All right, that was Dr. Deborah Simon, OBGYN for Gundersen Lutheran. We'll be right back. Stay with us.